اليوم راح نحكي عن الدنتال auxiliary أو ممكن إنه نسميه الأنسيلري مساعد طبيب الأسنان. As a definition, we can define dental auxiliary as a person who is given responsibility by a dentist so that he or she can help the dentist to render dental care, but who is not himself qualified with a dental degree. Their duties could be simple, such as sorting of instruments, to relatively complex procedures which form parts of a treatment. مساعد طبيب الأسنان هو شخص راح ينعطي فد مسؤولية من قبل طبيب الأسنان بحيث إنه ممكن إنه يمشي شغل، ولكنه لا يحتوي على فد شهادة، ليس عنده شهادة جامعية أو an academic dental degree. فممكن إنه ال duties تكون simple such as sorting of the instruments to more complex ones such as preparing cavities and filling them. Classification of the auxiliary could be according to the training that they receive. فممكن إنه التدريب يكون من عدة أشهر إلى حد السنتين. The task they are expected to undertake, some of them do only reversible types of conditions, and some are permitted to carry out irreversible. الirreversible مثل cavity preparation، هاي من ينعمل بالسن بعد ما راح يرجع السن لوضعه الأصلي. And also the legal restrictions، المسؤوليات القانونية اللي بينه. فأكو مثلا نيوزيلاند أو السكول dental nurse. She is responsible for taking care dental care of the children from nearly 2 years to 13 years of age. After that, when they graduate from the school, they will go to another region. She is not responsible for them. A classification. According to the World Health Organization 1967, the dental auxiliary was classified to operating and non-operating. Non-operating auxiliaries are divided into clinical and laboratory. A clinical is a person who assists the dentist in his clinical work but doesn't carry out any independent procedure in the oral cavity. يعني ما ممكن إنه يعمل فد شيء مستقل بداخل الفم. Laboratory, a person who assists the professional, the dentist, by carrying out certain technical laboratory procedures. راح يشتغل بالمختبر على الشغلات اللي مثلا طبعا يبعثها طبيب الأسنان وهكذا. Operating auxiliary, this is a person who, not being a professional, is permitted to carry out certain treatment procedures in the mouth under the direction and supervision of a professional. فهوني راح يكون تحت توجيه وإشراف من طبيب الأسنان. A revised classification، هذا هو التقسيم المنقح. Non-operating and operating auxiliaries can be divided. Non-operating include dental surgery assistant, dental secretary or receptionist, a dental laboratory technician or a mechanic, a dental health educator. For the operating auxiliaries, school dental nurse, dental therapist, dental hygienist, and expanded function dental auxiliary. We'll talk about each one of them briefly. فبالنسبة للdental surgery assistant, in 1885, a dentist was the one who began the trending, and a woman, he called her, she was usually a female, a woman, and called her a lady in attendance. يعني جاهزة لخدمة طبيب الأسنان. She will help the dentist in business office as well as at the chair side. She will perform non-technical work that do not require any or much training to ensure smooth running of the clinic, so that the dentist will concentrate and devote more attention to care of patients and spend more time providing actual dental care. فممكن إنه تناول الأدوات، تخبط المواد، تعقم، بحيث إنه طبيب الأسنان راح يقضي وقت أكثر بالعناية بالمريض والشغل الفعلي بفم المريض، بينما هي تهيئ له. She will ensure smooth running of the clinic. Duties of dental surgery assistant: reception of a patient, preparation of the patient for any treatment that he may need, preparation and provision of all necessary facilities such as mouthwashes, putting napkin on the patient, sterilization of the instruments, preparation and mixing of this restorative material including tooth fillings and impression materials, care of patients after a treatment until they leave, clearing away of the instruments, preparation for the surgery in case of another patient. They present the documents. الكيس شيت مثلا تقدمه لطبيب الأسنان. ممكن إنه instructions to the patient. تنطي after care of persons that have had general anesthesia. There is a variation in the utilization of dental assistant from office to office and from country to country. الواجبات راح تختلف. المساعد طبيب الأسنان dental surgery assistant من عيادة لعيادة ومن بلد للثاني. This is a brief review. Reception of the patient, preparation for any treatment, sterilization, preparation, patient instructions, mixing of the materials, after treatment care, preparation of the surgery for the next patient, presentation of documents, after care of patients with general anesthesia. We've got another term you should know is a four-handed dentistry. This is simply meaning that the dental assistant's two hands are going to assist the dentist's two hands, helping to reduce the amount of time a dental exam or procedure is going to take. Any dental professional will tell you that sitting at the chair side all day is uncomfortable and will result in lower back pain, tendinitis, and musculoskeletal complications. For this reason, they will split the work between them, dental, auxiliary, and the dentist. In many schools where there are dental auxiliaries in that country, the dental student and the dental auxiliary student will train together in order to achieve a smooth running of the dental procedure, and it will take less time. أكو four-handed dentistry and 6 نوبات طبيب الأسنان ومعانه 2 dental assistants. This is the incorrect sitting which causes the pain, the tendinitis, and many other muscle and neural problems. How many times do you turn your body or reach for an instrument? هسا راح نحكي هاي بس للاطلاع شوفوها. In the first term you took indices which were used to measure dental caries, periodontal disease, fluorosis, and other things. So there is also an index that classifies the movement. This is only for your knowledge so that you know. So class 1, there is only movement of the fingers, such as taking of a cotton roll. Class 2, the fingers and the wrist. This is such as transferring an instrument to the operator. الأصابع مع الرسل. Class 3, fingers, wrist and elbow. المرفق راح يبدي such as reaching for a handpiece. Class 4, the entire arm and shoulder. هون لحد الكتف مثل changing the light position, تغيير الضوء. وآخر شيء Class 5, the entire torso or when turning to reach for an equipment from the cabinet. الجذع كلته راح يبدي هاي Class 5. For the training, as we said, the operator and the assistant will have a certain sitting. For a right-handed, different from the left-handed dentist, we've got an operator zone, an assistant zone, and this is a static zone. And here is the transfer. هوني الأدوات راح تنتقل من واحد للثاني. بالنسبة لل-left-handed dentist, also there is an operator zone, an assistant zone, a static zone, and here is the transfer zone. الأدوات تنتقل من هوني. classification of the motion, we went through it. This is the six-handed dentistry. The dental professional, the dentist, with two dental auxiliaries that can help them in the work in order to have efficient work and reduce the time required to perform the work. Dental secretary or receptionist. This is a person that assists the dentist with secretarial work and patient reception duties. هون راح تحجز المواعيد وراح تنطي مواعيد للمرضى وتستقبلهم من يجون. A dental laboratory technician or dental mechanic. The main function is the fabrication of appliances. He should work according to the prescription and under the supervision of a fully qualified dentist. Dental laboratory technology is both a science and an art, since each dental patient needs are different. So the duties of a dental laboratory technician are comprehensive and variable. They are varied. Although dental technicians seldom work directly with the patient except under the direction of a licensed dentist, they are valuable members of the dental team. يعني عادة التدريب لهم راح يكون سنتين. Duties: casting of models for impressions made by the dentist and fabrication of dentures, splints, orthodontic appliance, inlays, crowns, and special trays. للصب والتصنيع التخومي والتقويم, orthodontic appliance, special tray, and so on. Denturist. This is a term applied to those dental laboratory technicians who are permitted to fabricate dentures directly for patients without prescription of a dentist. ADA defines denturism as the fitting and dispensing of dentures illegally to the public. فهوني موجودة بالdeveloped and in the developing countries. يعني مركب الأسنان ممكن إنه يركب مباشرة in the patient's mouth. This is to reduce the cost of the treatment. Dental health educator. This is a person whose instructions in the prevention of dental disease and who may also be permitted to apply preventive agents such as intraorally, such as the fluoride and so on, but they are not allowed to take up any other intraoral procedure. This is a dental health educator educating the children about a proper toothbrushing. Operating auxiliaries, including school dental nurses, dental therapists, dental hygienists, expanded function dental auxiliaries. A school dental nurse. During the First World War, dental diseases were very massive and there was a shortage of the dentists. So in 1921, in New Zealand, it was decided to train female dental nurses in order to carry out some of the dental procedures, and they graduated in 1923. The dental service offered to the children begins at the age of 2, and this will extend until 13 years of age for the children, and then they are discharged from the services of the dental nurse. يعني راح تكون مسؤولة بالمدرسة وراح يقع على عاتقها العناية والرعاية ب500 طفل موجود بالمدرسة. Functions of school dental nurse. We've got general and specific. General, maintaining a specific group of approximately 500 children in sound dental health and free from dental defects by examining and treating them at 6 monthly intervals. يعني كل 6 أشهر راح تجي تعالج ال defects that are occurring in them, teaching the principles of oral hygiene using modern teaching and publicity methods. Specific ones: examining patients orally and charting the dental conditions, a prophylaxis يعني تعمل scaling, topical fluoride application, advice on dietary fluoride supplements. She gives local anesthesia, cavity preparation, and placement of amalgam filling in primary and permanent teeth. pulp capping, extraction of primary teeth, individual patient instructions in toothbrushing and oral hygiene, classroom and parent-teacher dental health education, يعني one to group, recognizing malocclusion, and this then referring them to a specialist or an orthodontist. And as we said, it will take a training period of 2 years. Dental therapist. This is an operating auxiliary who is permitted to carry out the prescription of a supervising dentist of certain specified preventive and treatment measures, including preparation of cavities and restoration of teeth. فإذا الثيرابيست ممكن إنه يعمل he can prepare a cavity and apply the restorations to them. Duties include clinical diagnosis of the caries, cavity preparation in primary and permanent teeth, vital pulpotomies under rubber dam in deciduous teeth, extraction of primary teeth under local anesthesia. Also, the training period is 2 years. A dental hygienist. This is an operating auxiliary licensed and registered to practice dental hygiene under the law. So a dental hygienist is a person not being a dentist or a medical practitioner who does oral prophylaxis, gives instruction in oral hygiene and preventive dentistry, assists the dental surgeon in chairside work, and manages the office. هاي كلها dental hygienist. Duties. من اسمه hygienist. He scales on polishing the teeth, applies the fluoride and other preventive measures, diagnostic data collection, desensitization of the teeth after scaling and polishing, radiograph, bleaching, splints, sealant placement, preventive appointment, photography, educating patients to practice sound dental habits. Expanded function dental auxiliary. He has many names. You are responsible for one expanded function dental auxiliary. This is a dental assistant or hygienist in some cases who has received further training in duties related to the direct treatment of patients who still working under, but he is still working under the supervision of the dentist. The duties he places and removes of the rubber dam, places and removal of the temporary restorations, placing and removing of matrix bands, condensing and carving amalgam restoration in a previously placed teeth, placement of acrylic restorations in previously prepared teeth, and applying the finishing and polishing to the restoration. فهون placing of the restorations in the previously prepared teeth, he does not prepare the cavity. Thank you.